Let's do what this month has been dedicated to do worldwide, and is to ensure that we create some awareness about breast cancer and what the issues are. And so every October, there's the issue. And so we cannot pretend as though we're not part of that conversation. My guests are family medicine residents from the Kolebu Teaching Hospital, 7-member Society of Family Physicians of Ghana. Dr. Emmanuel Chuniboa, Dr. Lucy A.C. Turkson are my guests. Thank you very much indeed for your time. Now, there's the fascination about issues. I don't want to mention things. And when it gets to October, men are so excited. When we are serious about issues of education, some men are excited about things. Do you get that indication as well?
Oh yes, I do. I get that indication as well.
Please be telling them to be calming down. All right. Anyway, so what do you do as a family medicine resident? What's that?
Okay, so training is to be family physicians.
Okay.
As gatekeepers in our primary health care, to offer continuous, comprehensive, coordinated care to all patients we see, irrespective of age, gender, and all that. I mean, there are specialties that would deal with only seeing pediatric population, only seeing pregnant women, but the family physician sees everybody. And so we are seen as the gatekeepers of our healthcare system.
I see. So when I walk into the into the hospital, what are you supposed to do? Everything about me.
Yeah, everything. So we are basically primary caregivers.
Okay.
So we take care of the patient holistically, not only the hospital, like the problems that you present to the hospital, but sometimes you go all the way out to even to your houses and then try the community and try to talk to them, to educate them and all that.
I see. Yeah. Let's start talking about Pink October now. And forgive me, I'm not in pink. Myself a pinky pink tomorrow. Let's talk about Pink October, the idea of it.
Okay, so when it comes to Pink October, October is basically the month that is set aside for all of us to create awareness for breast cancer. Yeah, so we go all out, we try to educate people on what to look out for in terms of examination of the breast, and then to educate them on breast cancer in general. Yeah, so our main aim is for you to know how your breast look and feel like normally, so that when there is any abnormal findings, you might pick it up early.
I see.
And early detection is the key. It plays a major role in breast cancer.
I don't know whether you have played with the data and the numbers, whether or not they are surging or they are decreasing. But I'm too sure this is not the first time we've had campaigns. I've been on air for years, some years when I was here. We still had that. Do you think that the campaigns have gone down so well that we're having decreasing numbers of cases of breast cancer now?
Okay. So I'll say that there is a surge.
And there's a surge?
Yeah.
Wow.
Yeah. Because nowadays, at least, we all come together as a community. Everybody is aware of its environment.
Okay.
Yeah. So I can say that. Right. And then, according to statistics that was done by WHO in 2020, that's a Globocon, it was found out that 18.1% of people develop breast cancer. And then in Ghana here too, women with cancers, it accounts for 31.7%. Yes.
Wow. That's an interesting figure there. What's the theme of the campaign, Pink October?
All right. So for this year, we are running with a theme, Closing the Care Gap, Cherish Your Breasts.
Closing the care gap.
Cherish your breast.
Your breast.
So like my colleague said, the best way is breast awareness. Know how your breasts look like, how they feel like, so that it is easy for you to detect any changes and then report early to the hospital. So globally, like she said, the number of cases is rising globally. And then for us in Africa, low middle income countries, it has been realized that the patients come in more advanced stages of the disease. Elsewhere, they are detected very early. Even when it is difficult for you to feel a lump in the breast, they detect that the patients have breast cancer. Unlike in Africa, where the patients stay in in their homes for long, try all other things, and then when it's not working, before they report to the hospital. And so they come in very advanced stage of the disease, and unfortunately, we end up losing many of them as well.
I see.
And that is why the need for us to close the care gap and then cherish your breast.
When we're talking about the noticing changes in your breast, where do we draw the balance? Because we understand that as growth takes place, we are going to have changes in the breast. Because even when you give birth, there'll be changes.
Yeah.
What are the changes must we be looking at? Because I understand it cannot be the same. Year in, year out, it will change. So what exactly are you talking about when you talk about changes?
Okay. So as I said earlier on, you have to know how your breasts look and feel like. That's the main thing.
Right.
Because we are all different. So you have to know the size of your breast and how it looks like. So that when there is a minimal change in it, I'll talk about the changes that you have to look out for.
Later, right.
Yeah. But when there's a minimal change in it, you report to your GP as soon as possible. So maybe your GP will do a formal assessment on you, and based on your age, the specific thing will be required, whether an investigation and being an ultrasound or a mammogram will be requested based on your age.
I see. How common is that now in Ghana, breast cancer?
So breast cancer is very common. In fact, it is the commonest cancer in Ghana now. In both ages and cuts across ages and sexes. The number one commonest cancer in Ghana now is breast cancer. And in fact, it's the leading cause of deaths in terms of cancer. So it is quite common.
You said both sexes?
Yes.
Even men have breast cancer? Is that what I get?
So yes.
So one in 1,000 men have breast cancer.
Oh, how?
So with the women it's 1 in 8. So but the men is 1 in 1,000.
Wow.
Yeah.
I
So
see.
you also
Okay,
need to look out for these changes.
I see. So it's that common, and you've had cases, people come to the hospital with cases like that?
Yeah, we have people walking in. Yesterday, for instance, I saw a young man that walked in, and then he claimed that he has like disparities in the breast, like one is bigger than the other. So I examined the breast and I just asked him to do an ultrasound, and we take it up from there.
So what is causing this whole breast cancer thing?
Okay, so the exact cause still remain unknown.
Madam, if you say this, my body will do some way.
However, there are predisposing and risk factors. Okay, so I would say that you being a female, it predisposes you to have a breast cancer. And if you have a family history too, also the same. And then you previously been diagnosed of breast cancer is also another thing. Early menarche, that is menstruating before the age of 12, and then late menopause, as having been your menopause, never before, or you've never breastfed before, also it poses you at risk. We have some genes. We have BRCA1, BRCA2. That one is a little bit complicated, so we will not go in there. Yeah, so there are gene mutations. And then another thing is that if you've never ever had children, or if you give birth later in life as a woman, it also predisposes you. Hormonal replacement therapy is also another factor.
Late as in what? Late in...
late in like 45 going. Yeah.
So
then lifestyle modification, lifestyle like excessive alcohol intake, and then smoking is also another problem.
It's not interesting that within some few months or so we've been able to get courses for COVID, get even vaccine, and cancer, breast cancer, we still don't know what is causing it. It's not interesting, dog, because
so a lot of research and is going on into it. So I think for now, what we know is the risk factors. So we look out for those risk factors, and then as much as possible, we try and then deal with the risk factors.
We can just quickly go, but the risk factors is like going around. Right? Anyways, we'll leave it at that. But largely, so once it comes, you are looking at the symptoms. Let's talk about the symptoms now. What must you see that, and then you know that actually you are in trouble.
Okay, so as I said earlier, you have to know your breast. That's the main thing.
You the one carrying
you the one carrying the breast.
Know your breast.
You have to know your breast and know how it feel like.
Right.
Do you get the point? Yeah. so that if there are any changes, you seek
see.
medical attention
Right.
as soon as possible.
Right, okay.
So the changes you have to look out for is a painless lump in the breast.
Painless
Lump,
Okay.
yeah, in the breast.
Okay.
And if there are any skin changes around the breast, so the skin changes, you are looking out for any others like hyperpigmentation on the skin, hypopigmentation, redness on the skin, yeah, and then you look at the nipple too. The nipple area, you also check if there is any changes in the nipple area. Then the nipple itself, whether it has pulled in or caved in, you
I
also
see.
yes, you also look at all that.
You don't have
Then there
people
is
who
also-
are born that way, like, or the nipple is supposed to be
okay,
out.
that's why I'm saying you have to know your breast.
Uh-huh.
So that when you see any change,
okay,
you make the
okay,
move.
Okay. Are there other symptoms we have left out?
Like you said, so sometimes it can, the lump can be painful, but usually it is a painless lump. And then your breast also extends into your axilla or like your armpit. So you need to look for changes there as well. So sometimes there could be changes within your axilla.
So very soon we'll be helping
Yes,
them
we'll be
know
doing
what
that.
to do. Like
And then if
Yeah.
you have any nipple discharge, it is also important. If you see any discharge coming from your nipple, it's also important. It can be clear, it can be bloody or serous, whatever it is. Any fluid coming from your nipple, it is also important that you seek medical attention.
I see. Any other thing? Or that's enough.
That's enough.
That's enough.
That's enough.
So be on the lookout for that. It's very, very crucial. See, we don't want to lose anyone else. I'm too sure we need to get to a point where there's zero cases. How about the cure? Now that we cannot even buy the causes, can we cure it? Doc.
As for the cure, okay, so early detection, I would say saved life. So first of all, we have to, the cure depends on the stage of the condition. So if you come early, if it is detected early, we have treatment modalities based on that. So we have the chemotherapy, the immunotherapy, and then the radiotherapy based on that. And we have surgical intervention too. Yeah, so sometimes they have to do just the biopsy. They will use a biopsy to confirm it first before they will go on whether to take part of your breast tissue out or not. So everything depends on the staging.
I see.
Yeah.
I think it's time we could open the phone lines as well for people who want to call in and ask questions. 03029086007. Call us. Let's know what you. Please just ask your question. Don't come and be asking our breast. Please, I'm warning you. Don't come asking doctor here our breast. We all know breasts. This is not the time to teach you breast. Anyway, so let's look at the issue of protecting oneself now, because it's key. Key because beyond this, the early detection is what would help us and save people. So, protection. What do we do? Is it just examination?
I think that there are a lot of myths and misconceptions about breast cancer. So one of them that is trending now is if a man sucks your breast as a woman, it will reduce your chance of getting breast cancer.
It's not true.
It is not true.
Doctor Salah. What is this?
Oh,
What
it's
are you doing?
true.
You're just making everything make
So what that would do is that probably the man may be able to see those changes we are talking about and then inform you, the woman, that, oh, this breast
has changed. What
And
I've
then,
been doing, it has changed.
exactly. And then we advise you to seek care early.
So the sucking, no. It's
So
not.
what is known to reduce the risk of breast cancer is breastfeeding. Breastfeeding. So breastfeeding reduces the risk of breast cancer, but not sucking the breast when the woman is not lactating. So breastfeeding is known to reduce.
Even though it's
breast
good
cancer.
news, you spot people's plans. I'm telling you spot people's plans. So it's no milk in there for the baby.
Yes.
And
So
then
the baby is
full-grown
important.
man.
So the baby
They
is
should
very
stay off.
important. The baby is important. So
I just want us to be.
So on the
Clear
funny
on
side,
that.
someone will say that the milk is for the baby, but the breast itself is for the man.
Yes, and not for sucking as well, but holding and examining to get,
Yes,
lamps.
yes,
Is that not it?
Yes.
Good. Okay, so that's according to them, and that's not according to me.
There are also other things
Right,
we need to
right,
look. Yeah,
right.
so with a healthy lifestyle, you have to eat healthy. Like at least you have to have healthy living, eat good food, and then avoid alcohol.
Okay.
And another thing is that if you hit age 21 as a woman, you have to do breast self-examination every month. That's
okay.
a week after your menses.
Oh, I see.
Yeah, so you do that every
Can you
month.
repeat that for
So-
us and loudly this time?
Okay. So when you hit every woman, when you hit the age of 21, you need to do breast self-examination every month. Every month. So you stand in front of a mirror, and then after your menses, you stand in front of the mirror and then you do it. Yes.
Every month.
Yeah.